Welcome. I'm Reggie Kennedy, and on behalf of the Edward M. Kennedy Institute for the United States Senate, I want to welcome you all to the Kennedy Caucus Room for this very important conversation on the opioid epidemic. This is part of the Kennedy Institute's ongoing Across the Aisle series, where we bring together people from both sides of the aisle to consider and address the most important issues facing our country. When my husband, late Senator Edward M. Kennedy, first thought about this institute, he wanted it to be a place where we discuss the important issues of the day. I think it's fair to say that no one loved the United States Senate more than Ted Kennedy did. And he believed in the power of the Senate to address the great challenges facing our nation. Because men and women of both parties did, throughout our history, address the great challenges facing our nation. And so I'm proud to say that that's what we're going to be talking about today, the opioid epidemic, which is one of those great challenges facing our nation. I'm also proud to say that I'm here with our former Congressman Patrick Kennedy, who's on the board of the Kennedy Institute, but who has been a leading voice in addressing and speaking out on this epidemic. And he also is someone whom his father admired deeply. Teddy told me so often that one of the great joys and pleasures of his life was being able to serve in the Congress with his son. And it is my great pleasure, and it is with a heart filled with deep love, that I introduce him now, Congressman Patrick Kennedy.
Thank you very much, Vicki, and thanks for all that you've done to keep my father's legacy alive and dedicated to what he cared about the most, and that was this institution of the United States Senate and how it could be the salvation of democracy, because it was really the Senate that was the cup that held the hot cup of democracy, which means that this was the cooling off place. This is where, sounder minds could prevail, if you will, that people could actually come together and look out for the long-term interests of our nations and be freed from the immediate demands of the body politic, which, of course, these days we have to do both. But if it weren't for the Senate, we wouldn't have a chance to stop and take a breath once in a while, and that's what we're counting on the Senate to continue to do. This issue on the opioid crisis is one that's been around a long time. It's telling that it's taken us this long as a nation to finally begin to really talk about it at the highest levels of government. This is not a new crisis, and the reason it's taken us so long is that these illnesses are stigmatized, they're shamed, people who suffer from them do not feel they can speak up. The political advocacy around these issues is anemic, and it's all a direct result of the fact that for the history of our world, we have looked down on people who suffer from a brain illness whose symptoms manifest themselves in behavior, and that behavior is misunderstood and therefore judged, stigmatized, and marginalized to the parameters in our community where people are left in the shadows. So what do we need to do? I believe in process. I believe that unless we have accountability, we won't know what we want to do. So one of the things that the mental health and addiction community has never done, and that is put together a member's guide for our members of the House and the Senate to know what the issues are. Because it's no longer the purview of just a subcommittee on Labor H. It's an issue that affects every single committee in the United States Congress. And I guarantee you most senators and most members of the House wouldn't know that. They think it was a subcommittee on Ways and Means or Energy and Commerce or Labor H, when in fact, if you're on the Housing Committee, you are perhaps the most important senator or House of Representatives member in the Congress because of the importance of housing. Or you're on the Education Committee and you know about early screening and the importance of helping to build resiliency amongst our future generations, how important that Education Committee, and so forth and so on. So since leaving Congress, Congressman Ramstad, my Republican colleague, and I and others have put together Navigating the New Frontier of Mental Health and Addiction, which outlines all of the principal issues in the committees in Congress that those issues fall within. And to add to that, we are issuing, in addition to the President's recommendations, which came out yesterday on a commission that I was proud to serve on, appointed by the President, we made a number of recommendations. Maybe we should also hold those agencies within the federal government that the President recommends that we does certain things to help us address the opioid crisis. Maybe as members of the Congress, you, if you have benchmarks, can know how to press them on holding those agencies accountable. And by the way, every single agency within the President's administration testified in front of this commission and made the very recommendations that we put forward in the President's report. If we did nothing but held the President to the words of his own administration officials, we are going to dramatically improve the tragedy of our crisis in this country when it comes to overdose and suicide. And I finally mentioned suicide because one thing that's neglected oftentimes in the discussion of the opioid crisis is the mental health crisis. We have heard testimony after testimony about how these really should not be distinguished because people with mental illness self-medicate and become addicted, and people who have become addicted suffer from comorbidities and mental illness, and the two need to be seen as a combined effort. Finally, let me say, Governor Christie, who is our chairman, has not only expanded Medicaid in New Jersey, but is also appropriated, in addition to expanding Medicaid, $200 million just for the state of New Jersey, which if you extrapolate it across the country would mean that annually our nation, if it was to look for a ballpark figure on what we should be spending to address this crisis, would spend at least $10 billion a year. Richard Frank and others who've done serious economic surveys have said that that number should be more in the range of $20 billion a year, keeping in mind that HIV/AIDS funding per year during the height of the AIDS crisis was $24 billion a year. $24 billion a year for the HIV/AIDS crisis. Not to compare the value of lives, but there was 50,000 people who were dying of HIV/AIDS at the height of that epidemic. Today, there's 63,000 dying just of opioids, not including suicides, and we all know that that number is underreported. It could be as high as 100,000 people dying each year. This is a full-on epidemic that demands our immediate and undivided attention. And in this panel, we have those who have just done just that. Senator Portman, I think my colleague, Senator Whitehouse, who I'm always bragging about since his sponsorship of CARA, can appreciate. And I know Senator Shaheen, coming from the state that has been so hard hit from this, can appreciate that there's probably no U.S. senator who's made more speeches on the floor of the United States Senate on this issue than Senator Portman. And not only has he talked the talk, but he's walked the walk. Those of us who are in recovery remember, Senator, when you came down to the mall on a very wet and rainy day when we were rallying for support. And I have to say, you were among the few who weathered that, in addition to my good friend from Rhode Island, Senator Whitehouse. And I thank you all for your service to this cause and to this issue. And thank you for being here today, and to Carl, who covered my father for so many years and who really did right by my dad. He was honest, but he also was fair. And that says a lot for the reporters in this day and age, and we appreciate real fairness. And thank you, Carl, for that. And I'll turn it over to our colleagues.
Thank you, Patrick. I actually did do a lot of business with Senator Kennedy over the years, and he really taught me a lot about how the Senate worked and didn't work. And he's really missed. The caucus room, of course, is where both of his brothers announced their presidential runs. I don't think that would actually be allowed under the rules today. It was also the room where the first investigation into the sinking of the Titanic was held, so I'm hoping that we don't sink here. It's rare that I get to control 3 senators at once, so thank you for the opportunity to do this. Try to control. But obviously, I grew up in the Midwest, northern Midwest, so we're in the midst of a really serious healthcare crisis. And I thought we'd just start out by, why don't each of you describe sort of what's going on in your state, the extent of the problem, and what you've tried to do about it so far. Let's start with Senator Whitehouse.
Rhode Island is getting hit very hard. We're a state of 1 million people. We had over 300 deaths last year. We have communities like Burrillville, which is a very small corner up in our rural Northwest, that had 6 overdose deaths in the first quarter of the year before that, all at once. You have that happen in a community that small, and it's like beating on a bruise. The police officers have to respond over and over again. The few mortuaries that are there have to respond over and over there again. The rescue people. So it's hitting folks really, really hard. I was invited by the president to go down for the announcement that Patrick referenced, and I was unable to go because I had to go back to Rhode Island for the funeral of the daughter of dear friends of mine who had died of an overdose. So it's something that hits us all very hard. The good news is that Rhode Island has played a really, I think, profound role in trying to respond to it. And I want to recognize not only Patrick, who has been animated and passionate and determined on this subject for a long, long time, and I think now in his post-congressional career is perhaps even more effective than he was, even though he was the author of the parity bill. I just think he's really on a roll right now in the work that he's doing, and it's incredibly effective. So I thank him. We have Tom Coderre, who led as chief of staff at SAMHSA in the previous administration, and before that showed a lot of leadership in our Rhode Island Senate. Right now we have Eleanor McCants-Katz of Rhode Island as the new SAMHSA position directing the addiction opioid recovery side. And I see in the back of the room there another Rhode Islander, Jeffrey Tights, who served Senator Kennedy on the Help Committee for many years, and before that was chairman of our Rhode Island House Judiciary Committee with great distinction. So we're taking it very seriously. There remains a lot of work to be done. I'm extremely proud of the work that we did on the CARA bill. That was not just something that Rob and I came up with. We spent years holding conferences, bringing people in, finding consensus, drawing in law enforcement, veterans, medical providers, people in recovery, all of it to get a bill that, once it hit the floor, became almost unstoppable. And that, I think, was I will always be pleased and proud of working with Rob on that. And then on the floor, there was no person in the Senate more passionate about seeing to it that CARA did not pass empty-handed, that there was, in fact, money to support it, than Jeanne Shaheen. And I think that may be part of the reason that she is here, because she just was never going to let that issue go. And we all pulled together, and the result was $1 billion in extra grants to states, the first half of which is out, and the second half we expect in December, and $170 million extra in appropriations to the specified CARA programs in the last funding measure in April. So I would call that a beachhead rather than a victory, but it's been an important beachhead. And the thing that I like the most about the CARA bill, and I'll close with this, is that it was the first really significant step in Congress on the question of addiction that treated addiction as a fully medical condition and that recognized that there is something actually quite noble and brave about recovery. It is not a condition for which anybody needs to be ashamed, and bringing law enforcement and other kinds of discipline to the problem is really not helpful. And I think that was an important turning point for Congress. And the fact that across Congress people leapt to make that turn so readily, I hope is a good sign to the recovery community that we have your back and we'll work very hard to try to do more. So with that, Vicki, thank you for bringing us together. Thank you for what the Kennedy Institute has done. And Carl, back to you.
Senator Shaheen, why don't you talk about what's going on? I mean, it's obviously a very personal situation for all of you. You know these people.
We know these people.
And they're flesh and blood constituents.
Well, absolutely. And I very much appreciate Vicki and Patrick and the Kennedy Institute talking about this today, and appreciate the President's declaring a national public health or a public health emergency around the issue, because the more we can do to raise awareness, the more likely we're going to be to actually substantively address this issue. You know, in New Hampshire, we have the second highest overdose death rate in the country. We're a state of only 1.3 million people. And we have the highest death rate from fentanyl overdoses in the country. Last year we lost almost 500 people. This year we've already had 11 deaths from carfentanil, which is the elephant tranquilizer. So it is clearly a huge problem in our state, and you can't go into a community and talk to somebody who hasn't known someone who lost someone because of an overdose to opioids. And, you know, it's interesting because when I was governor in the late 90s and early 2000s, and we did not have this issue at that time. Even though we've had problems with substance use disorders for a long time, we didn't have it the way we have it now. And it really has been the result of the widespread prescribing and use of opioids. And that's got to be at the heart of what we do to address this issue. You know, Patrick talked about the shame and not speaking up. A couple of years ago, then Senator Kelly Ayotte and I held a hearing in New Hampshire, and one of the people who came and testified was Doug Griffin, who you may have heard yesterday responding to the Commission's recommendations. And one of the things that Doug said has really stuck with me. He lost his 19-year-old daughter, Courtney, to an opioid overdose. And he said, when that happened, we didn't want to talk about it. We didn't talk about her problem when she was trying to get treatment and when we were having challenges because we were embarrassed. He said, what we learned after her death is that we had to talk about it, that that's the only way we were going to make progress on this issue. And one of the things, as Patrick and Sheldon have both said, that has made a difference in New Hampshire has been people recognizing that this is a disease. This is not a moral failing. It's not a law enforcement issue, though that's a piece of it. But this is an illness, and we need to start treating it like other chronic illnesses and recognize we've got to provide treatment. We've got to understand that people often are going to need more than one round of that treatment, and they're going to have to be in recovery for the rest of their lives. And we need communities that support them in this. And I think in New Hampshire, one of the things that we're finding is working is communities coming together, schools and law enforcement and the medical community all working together to address this issue. And we have two very positive programs in our two largest cities that are sort of built on what the Gloucester police chief did in Massachusetts, called the Safe Station program. People can go into fire stations in Manchester and Nashua anytime, 24 hours a day, and they can get connected to treatment. In the fire stations, because they're open, when they go in and they're ready for treatment, and we know that when people are ready, we need to get them into treatment, that's the way to make sure they get the help they need. So In the Senate, as you can see from this panel, and as Carl says, we all feel passionately about this issue, there is bipartisan support to address this. And that is really important as we think about how to make progress. We need to make sure people can get treatment. In New Hampshire, the Affordable Care Act and the expansion of Medicaid has made a huge difference in providing treatment. We need to make sure that continues. We need to make sure that there's support for recovery, that prevention, prescription drug monitoring, all of the legislative fixes that we've tried to address in the Congress, and I'm proud to have, and I've intentionally tried to sponsor everything that I could think of to help address this. But there is no silver bullet. There are all of these things that we need to do in order to make progress, and we've got to work together to do them. We've got to act cooperatively, we've got to support communities, and we need resources to do that. So I'm pleased to have worked with both Sheldon and Rob to try and make progress on this issue, and I applaud the work that they've both done. Thank you.
You know, obviously that with the fire department, that's a great idea, but great use of resources, because better to have somebody come in and get treatment than they have to go to the house and try and revive them or not. So, Senator Portman, obviously there's been a major push of yours on the legislation earlier this year. Why don't you talk about Ohio and what your plans are going forward?
Well, thanks, Carl. And let me start by thanking everybody for being here and for your interest and for pushing us, because in the last year and a half, Congress has done more on this issue than in our entire history. And I started at this, as some of you know, many years ago when I was a new member of Congress, and a woman came to my office and said, you know, what are you doing to help? And her son had just died of an overdose. This was back in 1994, I believe. She had just presented a gold bracelet to me and then President Clinton. She was one of my constituents, and I was loaded with facts. You know, $15 billion a year spent on drug interdiction and criminal prosecutions, and she said, how does that help me? And she said, I go to my church, and they're in denial. Doesn't happen here, which still happens, as was noted earlier. The stigma is still there. She says, I go to the school, and they say, you know, we have this report card we got to meet every year, and we don't want people to think we have drug-infested schools here, so we're really not interested in talking about it. She called a meeting of her neighbors, and nobody showed up. And this is when we started this Community Anti-Drug Coalition effort. And General, I see you're here. Art, thank you for being here. And the coalition leaders I see here. And this was at a time when cocaine was the top issue, marijuana to a certain extent. There was no discussion of opioids particularly. 2,000 community coalitions have been spawned from that legislation. The Community Anti-Drug Coalitions of America has helped, but it's been, you know, pursued with vigor every year at the appropriations level to keep that funding going. So thanks for continuing to help that. But frankly, I'm discouraged, because after so many years of trying to help on the prevention side and the coalition side, and then we see this emergence of this new issue. And I remember back in the 90s, I started my own coalition back home, and I was chairing it. In the late 90s, we started to hear about OxyContin coming into northern Kentucky and southern Ohio. And this company called Purdue Pharma, and what they were doing to encourage people to take pain medication. And from that, as many of you have read about this and had the opportunity to look at the history, and, you know, we blew it, frankly. You know, we had our eye on the wrong ball, in a sense. You know, we were focused on one thing, and we made great progress with regard to cocaine and with regard to substance abuse generally among young people. But we missed it. We missed the power of opioids. And some of you have read Dreamland, and you can see how Ohio plays a central role in that. But I've seen it, you know, and this goes back over the last couple of decades, just grow and grow and grow. To the point today, Carl, to answer your question, we're in an epidemic in Ohio. We're top 5 in the country in overdose and deaths. If you walk into any firehouse in Ohio, and I do it frequently, and you ask them, do you do more fire runs or overdose runs? Of course, you know what they'll say. We do more heroin runs, as they say, or now fentanyl, carfentanil, they're synthetic heroines. If you talk to the police chiefs and the sheriffs, any place in Ohio now,
Okay.
and I think the same is true probably in Rhode Island and New Hampshire, they will tell you the number one cause of crime is this issue. So to my community members back home who maybe aren't as focused on it because they're one of the rare and fortunate families that haven't been directly affected, I say this affects all of us. It affects every person, whether you're directly impacted or not, whether you are like the parents who have come to me in Ohio and said, my 17-year-old kid, and this has happened twice now, went to get his and her wisdom teeth removed, were given opioids, and by the way, they're still given opioids, got addicted, physically addicted, a change, physiological change in his or her brain, and later, because of the lack of availability of pills and the cost of the pills, turned to heroin, overdosed, and died, both of them in their early 20s. I mean, that's reality in so many communities around the country. And so I am proud of the work that we have done, but we got to do much more. And let me say to Patrick, he has, during his time in Congress and as he left Congress, made this a personal issue, and I applaud him for that. And we talked about being on the mall together earlier, but you know, your willingness to take on this issue in a nonpartisan way, to join the commission, which I thought was very important, is truly appreciated. This cannot break down along partisan lines, and Sheldon and I are as different as night and day on some issues. But we are friends first, and second, you know, we decided 5 years ago this thing had to be addressed in a nonpartisan way, not just a bipartisan way. And he's right. We did spend about 4 years putting this bill together. Many of you were involved. We had 5 conferences here in Washington, D.C. about best practices from around the country, including prevention, education side, treatment, longer-term recovery. I think he's right in the sense this is the first bill that acknowledges in a general way that this is a disease, not a moral failing, and it must be treated as such. I also think it's the first legislation ever in Congress to provide any support, authorization, or funding for recovery. We focused on treatment before, but not the longer-term recovery that, of course, those of you in the field know is absolutely essential to successful recovery. You have to have some funding there, and you have to have a support network. And so I think that is good, and I think the CARA legislation, as it begins to be implemented, will make a difference. It's authorized at about $180 million a year, but this year we got $200 million into it, and that's very rare around here that you can exceed the authorization. Cures on top of it, which Jeannie was very involved with, and you know, I think the number in the end of $500 million a year is a good start, but it's not enough, unfortunately. And this goes directly to the states as compared to the CARA grants that are going to a lot of our great nonprofits. And so I think it's a start, and I think that we've got to fight for it again. So I would leave you with 3 requests today. One, help us on the funding. This is coming up in early December, so it's all coming back again. We did a good job in the funding that's currently in place, in the sense that we, you know, we're able to over-appropriate over the authorization. But help us with CARA, help us with cures. And then second, help us, if you would, with some legislation that's just sitting there poised to be passed that could really help. And Patrick's commission recommended that 2 of these legislative initiatives be passed. One is the Prescription Drug Monitoring Act, which frankly was part of CARA, but Sheldon and I were not successful in getting it through the conference with the House. And we can talk about why later perhaps. But the point is, no good reason. Yeah. This would effectively require states to have a monitoring program, those who don't. We have a pretty good one in Ohio, but also require states to provide information to other states. And this is part of the issue, as you know. I mean, Ohio is surrounded by a lot of states that have huge opioid problems, West Virginia, Kentucky, and Indiana, and Michigan. We've got to know what's going on between the states as well. And this legislation is required. This is a federal responsibility. So help us with that bill if you would. And then second bill is the STOP Act. And, you know, we can talk about the demand side versus the supply side. I will tell you, someone who has focused more on the demand side over the years, there is a unbelievable injustice right now that our own United States Post Office is carrying this fentanyl into our communities. And there's something we can do about it. I mean, it won't be perfect. Jeanne said there's no silver bullet, but this is one that's pretty obvious where most of it comes from China, most of it comes through the mail, most of it comes through the U.S. mail because they don't require the kind of information that the private carriers have to do, thanks to the 2002 law, which, by the way, recommended that the post office do the same thing and gave them some time to do it. They haven't done it, and they're still pushing back. And I would tell you, having talked to the Customs and Border Protection people and the DEA people, and having been at screening centers in Ohio and watched what they do with the private carriers to pull these packages off the line that are suspect, we need this information, because this poison is killing more people in Ohio today than heroin. The synthetic heroin is killing more people in Ohio today than heroin. It sounds like the same is true in New Hampshire. And then finally, this issue of looking back at antiquated law that had to do with mental health institutions that says there's a 16-bed limit to get Medicaid support. We have to blow the caps off that, and that was recommended also. And we have legislation to do that as well. So your help on the funding and your help on those legislative initiatives right now is very important. And if we do those things and fully implement Sheldon's legislation, my legislation, Jeanne's help on the funding, I do think we'll begin to turn the tide. I really do. It's not going to happen here in Washington. It's going to happen in your home, in your community, in your state. And so let's do all we can here, but let's continue to engage at the local level. Ultimately, this will be solved. Thanks, Carl.
So both of you hit on something that's really been interesting to me about this whole issue. You know, cocaine, pot, illegal drugs. There's always just been a different mindset about illegal drugs, prescription drugs. The New Yorker just did a huge story. I don't know how many people have read it on the Sackler family, the family that was behind Purdue Pharma and the development and, you know, the promotion of OxyContin. And, you know, part of the problem here to me is doctors and druggists and the pharmaceutical industry is playing a part in this, and these aren't normally, you know, what we consider the bad elements in the community, right? It's a big deal. I kind of call it lab coat crime, you know, as opposed to white collar crime. I mean, do we need to change our whole focus in thinking about that in law enforcement direction? And Senator Shaheen, you can go first.
Well, we had last Saturday was Drug Take Back Day, as some of you may know, and we did an event in New Hampshire with the father of a young man who overdosed on opioids. And one of the things the father said to me, his name is Jim Mosier, he said, you know, my son never would have done heroin because we had those conversations when he was growing up that you didn't do drugs. But I never had the conversation with him about prescriptions because, you know, of course they were prescribed, they were legal, they were something that you got when you were sick and they were supposed to make you better, he said. And so we never had that conversation. But absolutely, we've got to start talking about, and that needs to be included in medical education. I think the medical community has now started coming around, but they've been slow to recognize that they need to do a better job of educating doctors about prescribing. Because most doctors, you ask most doctors about what they learned about prescribing when they were in medical school, most of them will tell you they didn't. Because, of course, prescriptions are different for every individual, and so there's a lot of discretion. And so they didn't really think about that. This is a huge issue, and as we're addressing this problem, we've got to address that piece of it.
The thing I jump in with on that, Carl, is that it's noteworthy to me how attorneys general have responded with litigation. I know that Rob's Attorney General was one of the first to bring such a case, and now there are a number of them going forward. And there is something really quite wonderful about discovery. When you actually get to look in at the records of an individual or a company and figure out exactly what was going on. In Congress, we always get the spin doctors, we always get the talking points. There's no penalty for lying. In fact, it's usually kind of an attribute. But when you get into a courtroom, stuff gets punished if it's false. And the real documents come out. And I think that that's a process that we need to watch and encourage, and that is going to be very meaningful in terms of stopping the flow, showing the fault, and bringing lessons to the fore that we might not get. You know, we can call in the heads of Purdue Pharma, and they'll bring in their talking points, and they'll have their lawyers, and they'll have their stuff. But if we haven't gone into their files and found out what they were really saying to each other, what was really happening, which is what these cases and litigation will do, you just never get the full story. So there's a role for the judicial branch in all of this, and I hope that they do it rapidly and well.
Senator Portman.
Yeah, I agree. And I mentioned the issue of the young person who goes in for wisdom tooth removal and is given opioids. And in Ohio, we have a new law, by the way, that has a 7-day limit on opioids, which, with some exceptions for seniors, cancer, and so on. But I'm very supportive of that. So I have a young man come see me a couple months ago who says, I just want you to know, I know you're involved in this issue. I just had my wisdom tooth taken out, and they gave me 14 opioids. And he said, you know, because I'd heard you talking on the floor about how you shouldn't take these things. You know, I'm not a doctor, but I pretend to be one on the floor sometimes for this purpose. But he said, I took Advil and I was fine. So even in Ohio, you know, those 14 pills, for some people, and there's some professionals here in the room who can tell you why, perhaps, some people's brains are wired in a way that that's it. That can do it. That can literally have the physiological change. So we're still not there. Even if there's a limit of 14, there still needs to be a limitation on when it's prescribed and why. And you've heard the stories. I've had Ohioans come and tell me, I told the doctor that, you know, I'd had an issue with addiction in the past, and yet they insisted on giving me these pills, so I took them because it was the doctor, you know, and of course they know best. And we've all heard about this issue of pain becoming one of the vital signs, the fifth vital sign, and how people are judged and reimbursed based on the degree to which there's a smiley face on the right side of the card rather than an unhappy face on the left side in terms of your level of pain. And with doctors having less time with patients, it's just easier just to push the pain pills across the counter than to deal with some of the underlying causes of pain. So I don't think we're there yet, Carl. I know we've made great progress. If the AMA were here, they would tell you they have, and I've held them up, as have Jeanne and Sheldon, when they've done something good. The new person in charge of the Dental Association I spoke to last week about this topic. But there is so much more to be done in terms of education, medical school, but we can't unfortunately rely on that. We have to deal with the doctors who are there now and get them to stop the overprescribing and to be so much more careful. Now, I do have people come up to me too in Ohio, I'll tell you, and give me a hard time, who are people who have chronic illnesses, cancer, and so on, and they think I'm taking away their pain medication. And I'm not. You know, if you have a condition where this is required, you know, you should be able to have access. But I also say to them, there's no reason you need to have an opioid. And this is where I think the Commission did a good job, and I think CARA did a good job of setting up this interagency council, Sheldon, to say, let's get through FDA and through the HHS process and through the private sector non-addictive pain medication on the market so that these people who do have excruciating pain have some alternative to turn to. You know, there is Toradol, there is, you know, some very high dosage ibuprofens and so on that can be used, but why the heck haven't the pharmaceutical companies come up with something that is non-addictive that can deal with some of these broad spectrum pain issues? So I think we've got a ways to go.
And NIH also is working on non-addictive pain medications, so that's really positive. And to continue to fund that effort is probably going to be very important.
If I could mention two things. One, I think we do have to worry about the pendulum swinging back too far. I came into this issue when a woman at Brown University, Dr. Joan Tino, I still remember her, came up with a report that said that most people who died in Rhode Island hospitals died in pain. And of the people who died in pain, their families mostly reported that they died in excruciating pain. So obviously we need to get these often needed and valuable pharmaceuticals to the people who genuinely need them. But boy, we have let a lot of sloppiness, as Rob has pointed out, slip into the system. The second thing that I think we've got to deal with, which is going to be a tough issue, is HIPAA. I know of two families in Rhode Island who have lost adult children and discovered after the death that the adult child had been in and out of the emergency room over and over again, and nobody could tell him. Children do reach adulthood, but for God's sake, parents don't stop caring about them when they reach adulthood. And this is a plague in that young adult demographic where you are old enough to be able to make those decisions independently, old enough that your parents do not have parental rights on you, but still quite dependent and still very important relationship there. And so we've got to figure out how, when people do show up, they have their support network. There's always the odd case in which the father abused him and he's the only one left and they don't want to ever see him again. You know, you can work around that with alternatives, but I think this is a big, big hole in our system, that a person's support network isn't signaled when things have gone to hell.
Yeah, it's a tricky balancing act, obviously. You know, to me, this is an example of something I've seen over the years here in Congress, and as Patrick said, I've been here a lot of years. Geography is one of the things that can overcome partisanship.
Yeah.
When people share similar concerns in their geographic area, you know, the energy bill is kind of a place that legislation that works geographic, and this is kind of geographic too. You're in states that are hit hard by this, but you're all in agreement that this is an epidemic. You need to do what you can to directly affect it. I'm just wondering, can you work together on the underlying problems that are sort of leading to this? Because you've got, you know, unemployment, lack of opportunity, you know, sort of this feeling of desperation out in some of these communities. I mean, is this a stepping stone to broader agreement, or are you even working on those issues right now, or are those the kind of things that you can't come together on, how to address some of the economic issues? Is that a fair question?
Well, I like to think that we can address those issues, and you know, I think we can point to some efforts where we've tried to do that. Rob and I have had legislation around energy efficiency that we've introduced now. This is our 4th Congress, and there are a lot of jobs that can be created if we can get this legislation passed, and that's an issue that isn't about partisanship. It's really about, as you point out, geography and whether you support clean energy or fossil fuels. So I do think that there are lots of places where we not only can come together, but where we have come together to try and make progress on challenges to the underlying issues. But again, I would say that we know what many of the causes of this epidemic are. And we've, you know, Rob and Sheldon, and we've all talked about them here. One of those is the overprescribing of opioids. You know, let's get at that. If we can get at that, that would address a lot of the problem that we're seeing with this epidemic.
I would say, I agree with what you just said. For those of you who follow this closely, you know this, but probably the experts tell us probably 4 out of 5 people who overdose in Ohio or New Hampshire, Rhode Island, started on prescription drugs, and they tend not to overdose on the drugs. They tend to overdose on heroin or fentanyl, carfentanil. And so just, if you're wondering why we're talking about prescription drugs so much, it's because that not just was the origins of this addiction in places like Southern Ohio, but continues to be a huge reason that people then turn to some other drug that ends up causing their death, but really it starts with an addiction. But, Carl, I would challenge you a little on your premise. And there are certainly belts of despair in my home state where you see relatively high rates of opioid addiction, but it's everywhere. I mean, I have gone to funerals of people who are middle class, upper middle class, poor, you know, every socioeconomic level, but also every geographic area. I mean, you think about the cocaine epidemic and being in the inner city. You think about marijuana being maybe more a suburban issue at one time. Now, maybe not so much, but now this is not, you know, meth being more rural. This is, at least in my state, it knows no zip code. And so people who have this emptiness, I do think, tend to turn to some sort of alternative, like a drug or alcohol, no question about it. And let the experts talk about that. But this one's not so easy. In other words, you can't just point to poverty and say this is the reason, because it is literally everywhere. I've had some African-American friends back home say, gosh, why are you so interested in opioids? When it was cocaine, you guys didn't care that much. And my answer, part of that is actually that's how I got involved, was when it was cocaine, and crack cocaine and powder cocaine. It was more in the African-American community. But I would tell you the numbers on opioids now in our areas, and the medical director in Cuyahoga County, Cleveland, gives us a monthly report. And every month there is a higher percentage of African Americans who are affected by this. And he says the reason is that now fentanyl is being sprinkled in cocaine and marijuana and heroin and so on. But the point is, it is just across the board. And so it has to have a very holistic approach.
So I did want to talk about the president, obviously declared a national emergency last week. People saw that as a step forward, but there were criticisms that it was also a little bit of a just say no approach, and they were going to do advertising. I'll start with Senator Portman. So what did you think about what the president was saying, and is that enough? It has to be enhanced. What are you going to do with it?
Yeah, look, I don't want to hear from my colleagues on it, but as I said, I thought Patrick and the Commission did a good job. I like the fact that they specifically identified legislative initiatives and said, we need to get these things across the finish line, which you didn't have to do. I think on the prevention side, the president's comments were very important, because I do think, we sort of lurch headlong into dealing with putting the tourniquet on as we must on treatment and recovery and so on. But ultimately, if we can have a national dialogue more like we've had on drunk driving or on smoking, we can make progress here on this more holistic issue I talked about. I don't agree that it's among young people. That was one of the things that was said. This is about young people. Unfortunately, it's everywhere, as I said. So you have people dying in Ohio who are in their 70s and in their early teens, all in the same month. But I think the prevention idea, when Sheldon and I wrote the legislation, we authorized a national media campaign. This is authorized by the U.S. Congress. Funding's available. And, that has yet to have been implemented by either the Obama administration or the Trump administration. So we're actually supportive of that. And I think, Sheldon, you and I thought at the time this would be more about educating people about the role prescription drugs play for all the reasons we've talked about today, which is, gosh, your doctor's prescribing it, must be okay. And many of my constituents, I used to say most, maybe not most anymore, but many have no clue about this. So I think the prevention side is important. I guess my only thought about, the national health emergency and the announcement is, the funding. And I wish that, and I think Sheldon and I have talked about this, he agrees with me, that he had put more pressure on us. Because, Congress appropriates every dime. And so we have provided some authorization and some funding that they could use more effectively, in my view, but we also need to have him say to us, hey, we need some money.
Well, Senator Shaheen's on approach, I think so.
I was pleased to hear the president declare the public health emergency. I think it is a public health emergency, and I think anything we can do to raise attention to the issue is very important. I was pleased with a lot of the recommendations, because we do need to do all those things. I was disappointed that one of the recommendations wasn't that there be more resources, because that's clearly a piece of what we've got to do. I have communities in New Hampshire who are raising money through bake sales to support recovery centers. We need to help those folks. The other two things that I think are really important is, as Patrick said, what we see so often with people with substance use disorders are co-occurring other mental health issues. And we've got to recognize that we need to address those together. And the way we're going to do this is by making sure that people have access to treatment, to health care. So in New Hampshire, that's what's made a huge issue, is people now, because of the expansion of Medicaid, can get access to treatment, both for mental health and for substance use disorders. And anything that we do that doesn't continue that access to health care and treatment for people is going backwards. So I think we've got to do everything we can. And that's the trip that I'm on. I want to do everything we can.
I would echo what both of my colleagues said about the need to actually put the real resources there. I would add that I was very happy that the prescription drug monitoring programs came up over and over and over again in this, because that's an easy, good, smart thing to do, and it's just ridiculous that that hasn't been done better so far. I think it would also be helpful if the Department of Justice and the Office of Management and Budget got on board, because there's a big disconnect between the report and the OMB budget in these areas, and there's a huge difference between the report and where the Department of Justice seems to be going in terms of charging the greatest crime always and going back to the kind of bad old days. The report's recognition of the value of drug courts is incredibly important, and I would signal the HOPE program in our federal court in Providence, Rhode Island, as a way in which the court, even the federal court, is getting involved in helping the individuals before them try to avoid a record, clean up their lives, and figure out what the standards are that they're going to have to meet to be excused from some of the consequences for what they did. It's very successful, but it would be really helpful, I think, if that message came from the Attorney General as well.
So we're literally got about 2 minutes left. Starting with Senator Portman, just some last thoughts and maybe some hope here so we don't leave here thinking, oh my God, we're never going to get this under control.
Well, it is frustrating because despite a lot of good efforts by a lot of people in this room, Carl, including Patrick and Vicki and others, it's getting worse, not better right now, I think. And that's based on data in my state, but also some national data. However, I have to believe that what we have now begun, and remember, CARA is just being implemented now. I mean, literally in the last 6 months, these programs have started to be funded. So about 10 different grant programs. The money that went out from Cures, about $28 million for Ohio last year, is now being implemented. And I will give you just one quick example of where I have hope. In Columbus, Ohio, they took the Cures money, combined it with some other local monies, and they took an old hospital and renovated it. And by January, February this year, I hope, there will be a facility where people who have overdosed will be taken. So the EMS personnel will be told, if you're applying Narcan, that's great, but instead of taking them to 6 different emergency rooms around the city, and I've visited some of these emergency rooms and see what happens, see the enormous, by the way, time and effort and money that goes into this, and the frustration of these EMS personnel and the nurses and others that the same person comes back again and again. Instead, they will go to this emergency room centrally located in Columbus, and at that emergency room there will not only be the appropriate way to deal with overdose patients as opposed to gunshot wounds and car accidents and so on, so it'll be more efficient and frankly better for those patients, but also there are 50 beds, 50 treatment beds right there in the same facility. And the question is, how do you get those people from that emergency room and that overdose into that bed? And that's still somewhat of a challenge, but it will be much more easily facilitated to deal with a huge problem, which is a gap between saving someone's life and getting someone into longer-term treatment and recovery. And then that gap between the treatment, 30 or 60 days, and recovery is also being addressed by the same group. And it's being run by the Addis board. It's a community-wide effort. And I think that's really exciting. And that's a specific example of where the funding that we've provided is going into something that's making a difference at the local level, where it's ultimately going to make the biggest difference. So I would leave you with that hopeful note. I think we can turn the tide. I really do. I have to believe it. You have to believe it. The alternative is unthinkable. Not just the overdoses, but all the lives that have been ruined through addiction. I've probably met with 1,000 addicts or recovering addicts in the last couple of years, and the stories are remarkably similar, which is it became everything. It became everything. It took me from my job. It took me from my family. It took me from my friends. I think this work we're doing here is, again, just part of it, but it has stimulated, I hope, some great activity at the local level that can turn the tide.
Yeah, I also am hopeful. Even though the numbers in lots of places may not look like they're getting better, what I think is making the difference is not just whatever legislation we do here and what resources we provide, but it's those people speaking up, the people who have lost someone, the people who are in recovery, who are willing to go out and say, we're going to make a difference in our communities to address this. And I'm seeing in places like Laconia, New Hampshire, where that is making a difference. So it's going to take us a long time, and we're going to have to continue all of these efforts, but I do believe we can defeat this.
I think the tide of recovery is running our way, and we are actually winning, or would actually be winning, were it not for the technical advantages of fentanyl and carfentanil and how that has changed things. And that's quite recent. And if we can address that fentanyl problem in a significant way, then I think the successes we're having on the recovery side will be more revealed and will go forward. The thing that brings a smile to my face is thinking about the really wonderful young woman who was embedded with the West Warwick Police Department, a very small police department in our state. She comes from Anchor Recovery, I believe, and she goes out with the police officers when they go out on appropriate runs, and when they come back with reports of things that are germane, there's a nice young police officer who goes with her. They go out in civilian clothes, they knock on the door, they say, you know, we had to come to your place last night, what can we do? And it has changed so many relationships in that small town, of the police with the whole question of recovery, of the police with the community who are facing this problem, and of the kind of confidence of folks who are facing addiction that, wow, the police actually want to help me with this. This is different. So, you know, you start adding up those little fine people doing beautiful work, and it starts to kind of glow a bit, and we just need more of that.
I think it's going to take a lot of that, but that was all more uplifting than some of the other things we're talking about. Thank you, everyone. I think that's our time is up.
Thank you, Carl.